Good morning, everyone. Welcome to another of the Dr. Joseph St.Elmo Hall Memorial Lecture Series. We're doing this meeting, as you can see, through digital media. Thanks to COVID for this. Not allowing us to meet face-to-face. This meeting should have been held, as you know, earlier this year in collaboration with the Gynaecologist Cancer Society, but COVID had other plans for us. We're hoping that this webinar would certainly stimulate your interest. And this morning, we'll be looking at the traditional things related to cervical cancer. But in the mix, we're adding the neighbor, the uterus, and that will be dealt with by Dr. Guthrie. I'm so happy to have with us as well our chairman of the Jamaica Cancer Society, Mr. Earl Jarrett, and you'll be hearing from him shortly. In terms of housekeeping, I want you all to keep your microphone off. We'll have question and answers at the end. You can actually use the chat button below to send in your questions. And in addition to that, you can also collect your CMEs next Tuesday if you go into the office, Jamaica Cancer Society, to pay, and you can collect. So I want you to sit back, relax, and enjoy. So I now introduce Mr. Earl Jarrett, who will just give a little introduction. He's the chairman of the Jamaica Cancer Society. The floor is yours, Mr. Jarrett.
Thank you so much. And I want to thank you, the panelists, Dr. Guthrie, Dr. Matthew Taylor, and you, the moderator, Dr. Bambury, for coming out this morning to participate in this seminar. As you have rightly said, it's a change. The world has actually changed on us, and it seems that will be a much longer change than we anticipated, and we now have to interact in a different way. And so we're going to use the modalities of online interaction to get the message across. In other words, the Cancer Society is not going to just fold up and not do anything, but we're going to use the tools that are available to us to reach persons, not just in Jamaica now, but it gives us the opportunity to reach the wider world, in fact. And so we're going to make sure that we find a way to do that. As you know, the Cancer Society was established to fight and defeat cancer. And one of those great fighters was Dr. Hall, who dedicated his life to medicine in general, with a specific focus on gynecology, with a special interest in cervical cancer and cancer of the uterus. Dr. Hall joined the Cancer Society in 1969 and served as the lead gynecologist for the society. He introduced many new techniques to the society in those days, including the colposcopy services, which were introduced in 1978. He was also a great advocate for cancer and cervical cancer in particular. And he dedicated his time and used every opportunity at his power to inform the public, including policymakers, on the impact of cervical cancer on women in Jamaica. He was an advocate for screening and for testing. In fact, if you were to reflect on Dr. Hall, what he tried to do in his time was to flatten the curve of cervical cancer by testing and by giving great information to the public. His goal was to reduce the burden of cervical cancer on the Jamaican woman and the Jamaican family. And he did it in the ways that he could find. Through his skills, through his network of students and doctors, and through his connections with the policymakers in Jamaica. Dr. Hall was a philanthropist who invested his own funds to support the work of the Cancer Society. As are many of the persons on the panel here. I could say the same for Dr. Bambury and Dr. Guthrie. He used his own funds to support our work. And by investing his money, he was able to attract counterparty funding from firms, from individuals, to support and the work of the Cancer Society. He individually staged a national drive to increase the number of women screened for Cancer Society across Jamaica by raising funds, by getting the tools, by purchasing televisions, by driving his little van around the countryside and hosting these seminars with the Jamaican women. Dr. Hall turned out to have become a publicist was able to bring many voices to the cause for cervical cancer, including prime ministers, dance hall artists and entertainers, and other influencers to encourage Jamaican women to be screened for cervical cancer. Dr. Hall was a recruiter of persons. He was able to influence his former students, now doctors, to volunteer across the country in the fight against cervical cancer. He recognized the need to build a network of supporters and a network of facilities to encourage Jamaican women, particularly rural women, to be screened for cervical cancer. And by so doing, he established he co-founded the St. Elizabeth branch of the Jamaica Cancer Society. And he traveled far and wide across hills and valleys to have seminars, to have discussions with smaller groups. Maybe he was influenced by his own involvement in the political movement in Jamaica. Many persons do not know it, but Joseph Hall was a politician in his own way. And he did speak to any group, no matter how small, to encourage women in particular to be screened for cervical cancer and to be aware of the symptoms and indicators for cervical cancer. He also recognized that no woman in Jamaica should really die from cervical cancer if the cancer is detected early, if from early detection, medical intervention can take place. He was a humble giant in the fight to reduce the burden of cancer and in the development of Jamaica overall. Dr. Hall was not one to blow his own trumpet, but just simply did the work. I admired him for what he was doing in Jamaica. Today, we continue the work of Dr. Hall, who this year would have been 97 years would have been 97 years had he lived. So he was born 97 years ago. And hopefully at his 100th birthday anniversary, we would have made significant advances in the reduction of cervical cancer in Jamaica. Today's objective is to have an in-depth discussion on cervical cancer and endometrial cancer, a cancer that we don't talk a lot about. But a lot of women in Jamaica do have endometriosis, and endometrial cancer is a subject matter that we need to talk about. We will learn today of the incidence of cervical cancer in Jamaica, and the panelists who, for many, were colleagues or students of Dr. Hall, will provide you with current thoughts on gynecological cancers. Thank you for joining us through this medium, and of course, I can't leave without encouraging you to become full-paying members of the Cancer Society so that our work can continue into the future. Thank you, Moderator, Dr. Bambury.
Thank you so much, Mr. Chairman, Mr. Jarrett. And so we now bring to the podium Dr. Wendell Guthrie, a well-renowned obstetrician and gynecologist, and really requires no introduction. Very jovial, and certainly persons enjoy his previous talks. And today he'll be looking at endometrial cancer, a neighbor of the cervix, which we don't speak too much about recently. So the floor is open to you, Dr. Guthrie.